Hello and welcome to this Beyond Blue webinar that's all about how we can get better sleep and improve our mental health. Because we know that for many people, problem sleeping can be one of the earliest signs that your mental health is starting to trend down. So taking some early action to get on top of it can really help. My name's Luke Martin. I'm a clinical psychologist here at Beyond Blue, and I will be your host for today. Before we get started, I'd like to acknowledge the traditional owners of the lands we're all joining from today. I'm here in the Beyond Blue head office, which is on the lands of the Wurundjeri peoples. So I pay my respects to their elders, past and present, and extend that respect to the elders on the lands that you're joining from today as well. I'd also like to acknowledge those of us who are living with and managing mental health conditions like depression and anxiety, as well as their friends, family and supporters, and those affected by suicide. Okay, so for today, we really encourage you to pop your questions in the Q&A chat box as we go. The second half of this webinar is dedicated to our panel answering your questions. So please pop them in the chat. And so without further ado, I would love to introduce our panel. We have a fantastic panel. First up, we have one of Australia's most well-known and trusted doctors and health journalists. We are absolutely thrilled to have Dr. Norman Swan with us today.
Hi.
Thank you so much for joining us, Norman. We also have the absolutely brilliant Dr. Moira Junger, who is a health psychologist and the CEO of the Sleep Health Foundation. Welcome, Moira.
Hi, thank you.
And last but not least, we have Karina Bates, who is a Beyond Blue speaker, who will be sharing with us some of her experiences managing her mental health and the role that sleep has played in that. Welcome, Karina.
Well, thank you.
So I'm going to really briefly set the scene for this conversation. Before this webinar, we consulted with over 400 members of our lived experience community to learn a little bit more about this link between sleep and mental health. And a few things really stood out from that consultation. Firstly, is that 91% of our community were very aware of how important sleep is for their mental health. So you get it. So today, we're not going to spend a lot of time hammering home how important sleep is, because we also heard that for some poor sleepers, emphasising that point can kind of make things worse because it just makes us more anxious about our sleep. So today, we're really going to focus on sleep strategies. The other thing that stood out was that we often talk about sleep and mental health being two sides of the same coin, that each can influence the other. Now, this is very accurate to say, but it doesn't really convey how frustrating and distressing that link can become. And so we heard a lot of people's experience where sleep and mental health can kind of play out in a bit of a vicious cycle where you have the racing mind at night, which makes it really hard to get to sleep. And then it has some impacts for you the next day, which then can worsen your mental health. And then you get quite anxious about getting enough sleep that night, which makes it even harder to get to sleep. And this cycle can kind of carry on over time. And so today's conversation is really about how do we help break this cycle? And knowing that the moment you fall asleep is out of your control, how do we kind of tip the scale so that we're more likely to sleep rather than less likely to sleep? And we've got a fabulous panel to step us through how to do that today. And just a final note from me is that, often when we're having problems sleeping, it can be a really kind of natural reaction if we're dealing with kind of very hard things in life. And so in those situations, we don't need more sleep tips. We really need some really solid support. So just a reminder that the Beyond Blue support service is available 24/7 on 1300 22 46 36 or online at beyondblue.org.au. Okay, I think that is more than enough from me. I would love to bring the panel in now. Norman, I might start with you if that's okay. People are often, very worried about getting enough sleep, but how much sleep do we actually need, and are there big individual differences?
There are huge individual differences. Karina and Moira will no doubt expand on this, but there are enormous individual differences. And there is a lot of help out there, and cognitive behavioral therapy for insomnia is incredibly effective. But my understanding of the evidence is that even the best CBTI will not turn you from a 6-hour night sleeper into an 8-hour night sleeper. What it will do is give you a better night's sleep. And sleep research has really been very badly done. It's not high quality, even though there's a mountain of stuff. Some of it's conflicted. People who run sleep centers who want to get you in there to have sleep studies done. There are people out there wanting to make money from you from sleep. And there's been a lot of focus on the literature on sleep duration. When you dig down into sleep duration, it turns out that, yeah, sure. If I know you don't want to obsess with mental health and so on, but there's also general health. If you sleep on average, if you sleep 6 hours a night or less or fewer, then there are increasing problems with chronic disease, mental health issues, and so on. But it's also true if you sleep 9 or 10 hours a night or more. But when you actually look in detail at this evidence, it's actually not so much about duration. It's about sleep quality. And it's also about the sort of people who might be doing this. So if you're a 9 or 10 hours sleep or more, you tend to be older. You also tend to be lying in bed trying to get to sleep rather than necessarily sleeping. And you also are probably a little bit sicker already, and that biases the results. So it's not so much you're sleeping 9 or 10 hours, it's a marker of other things. And sleeping 6 hours a night or less is a marker of other things. What seems to be much more important is the quality of your night's sleep. Are you getting off to sleep when you want to? Are you not waking up during the night and festering and so on? And you get to the morning and you're feeling refreshed. I mean, really interesting to hear the discussion that goes on after this. But if you can achieve that, we should just stop. I mean, I argue that there's an epidemic of insomnia because we're all terrified of insomnia. Fear has been put in our hearts if we're not sleeping 7 or 8 hours a night. 7 or 8 hours a night is just a statistical thing where you look at the overall population. There seems to be a sweet spot around 7 or 8 hours. There is nothing magical about 7 or 8 hours. Really, what you've got to focus on is sleep quality. With children, there's a bit more evidence. Infants up to about 12 months of age, probably 12 to 16 hours, including naps. But again, even that makes parents anxious because they're not doing it, and some kids can survive on less. 1 to 2 years, it just goes down as a child gets older, including naps. But even teenagers who notoriously don't go to sleep till 2 in the morning, they still need 8 or 10 hours a night. It's just that the 8 or 10 hours tends to go into when they should be at school in the morning. So there's just different patterns going on.
That's interesting. So it's a bit of a mixture of, there's kind of a sweet spot window, but it's really more about quality than being preoccupied with a certain number. That's really
my understanding. That's my understanding of the evidence. And I looked at it a lot in my last book, So You Want to Live Younger, Longer. So there's a lot of emphasis on sleep. Interestingly, the international group that brings together evidence on dementia did not put lack of sleep as a risk factor for dementia because they felt the research was not strong enough. So that should give us all hope.
And you mentioned there, Norman, about childhood, and we know kind of laying the foundations for good sleep for life often does begin in childhood. And you do have a new book out that I want to mention as well, which is so you want to know what's good for your kids, which is
not
great.
Not that I'm plugging it. But,
it's right there as well, which is fantastic. So obviously beyond that point of let's not let's try and get things in balance. What do parents need to know about how to get better sleep for their kids?
I think the first thing is every child is different. Professor Sally Staton at the Queensland Brain Institute is one of the few researchers internationally who actually researches sleep in children. Everybody talks about it, but not that many people research it. She sort of smiled at me wryly when I told her I was writing this book. And she said, you know what I tell parents who buy a book on sleep for their kids? I said, go to the front cover, and does it have your child's name on the front cover, printed on the front cover? If not, take it with a pinch of salt, because her research shows it's so highly individualistic to a child. We have different relationships with each child. Each child is different. They have their own patterns. Yeah, and you've got kids who are twins or very closely born together. They can influence each other's sleeping, but every kid is different. And sadly, it's not one size fits all. You can have this perfect child. Your friends boast about their perfect children, how they sleep right through. Well, be careful what you wish for, because the second one won't do it. It'll be the nightmare child, and then you wonder what hit you.
They do say that, yeah, parenting's not a level playing field. You really need to know your kid and work with your kid. Just and finally, Norman, what would be for adults, general population adults, what are some of your top sleep tips?
Well, I think everybody now knows about sleep hygiene, darkened room, don't have don't go, so I won't go through sleep hygiene. I'm sure Maura and Karina will talk about that. It's not to get anxious about, there's plenty, you can be anxious in your own right, and anxiety is causing you a problem, and depression is causing you a problem. And it's important to get that sorted out. But don't get anxious about your sleep would be my first recommendation. If you're not necessarily an anxious person, but you're not sleeping, try not to get too anxious about that, because you can get into a vicious cycle. And and some of the techniques you need to get a better night, you probably need some help. There's techniques that Maura, I'm sure, will talk about, which is actually about shrinking the amount of sleep you get at night, so you get a good night's sleep and then slowly extending it. Now, that's hard to do by yourself. You really need somebody to help you, either online or face-to-face, to actually make that work. So there's some stuff that helps you to sleep, which is counterintuitive, but stay away from the screens. It's not so much this blue light, blah, 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 or your pineal gland. It's more that it just gets your brain going. The same way as that you shouldn't have a television on in your bedroom either. It just, you're there to sleep. You're there to settle your brain, not to stimulate it. That would be my high level stuff.
Yeah, fantastic. Thank you, Norman. That's great. It'd be great to dip into a few more of those tips as we go throughout this webinar as well. Moira, I might move across to you now, and as a health psychologist, what's some of the mechanisms that explains why sleep does affect our mental health so much?
Yeah, it's a great question. And it's because our sleep health and our mental health are close first cousins. They're not the same, but they're closely connected. And they're both are complex, and both are really determined by many different things, like our biological, psychological, social. So it's just our brain health, our general health, our jobs, our postcode, our exposure to light and dark at different times, our food, our physical fitness, etc. And I'm really aware to be short and sharp with my answers today. So the short answer really is that it's such a strong relationship because it's a bi-directional one. And we know that it can be self-reinforcing. So when we've got poor sleep, we're more prone to anxiety and depression, etc. And obviously when we've got poor mental health, sleep is harder to come by, or it's disturbed in some way. It's a manifestation of 90% of people with mental health conditions have some kind of sleep disturbance. So and we know because sleep generally is meant to be for restoration and rest and repair of cells, clearance of toxins, all that sort of stuff that happens in sleep. So if we don't get that, when we don't get that general sort of refresh and reset, our systems are under strain. So our nervous system and our ability to regulate is impaired. So that's sort of the nutshell of why it's such an important relationship and why we need to talk about it more. And it's because it's not really well understood, I don't think. I think that a lot of people think that sleep is just subsumed under mental health, for instance. And of course, it's similar, there's crossover, but it's really distinctly different.
Yeah, and that idea that it's very much a two-way street, where I read a paper where there was not a single psychological diagnosis that sleep wasn't affected by, but by the same token, the street runs the other way as well, where sleeping problems can be a lead indicator that there might be an emerging, depression or anxiety coming on. So I guess the golden question of today is that cycle that I mentioned up front, and you've just mentioned then, how do we break this cycle? Like, I know it's easier said than done. How do we stop being anxious about our sleep? How do we break this cycle?
Yeah, well, so it's so important just to identify that there is a cycle. There is a vicious cycle, and it's really common with particularly insomnia and anxiety. And I agree with Norman that I think society in general, part of the problem is sometimes we're not sleeping well because we're anxious about not sleeping well. So that's a big problem that needs to, and Sleep Health Foundation, and we hope the tone is right. Like we really address that in the tone and with the evidence. So we know that nearly every person I ever saw as a psychologist specialising in insomnia, it's not my current role, but nearly everyone I saw had developed their insomnia for a set of special circumstances. Something happened, there were some circumstances that it brought on, but then treating it was getting to the heart of what was keeping it going. So this perpetuation is probably very different to whatever started it. And it's a really debilitating cycle, and it's a real rut that, that I'm sure Karina will talk about it. It's a very, very difficult thing. And I think it's why I feel so passionate about it, that it's nothing worse. Very few, like pain and stuff is bad as well. But, not sleeping is just a very awful thing when people are in that cycle. So it's sort of, I think the answer really is, and I suppose if I can bring that clinical side of it to the public today, is that my job as a psychologist was to co-construct with that person like this the answer to what is keeping you awake after all this effort, all these things you're trying, all these things you've gone, you've tried this, you tried that, you've been worrying about it for a long time. So we've got to look at why you haven't got your sleep sorted when there are other things settled, like the divorce or your mental health's a bit better now, or things are different but your sleep's still poor. So it's about not worrying about it, as Norman said. But the tricky thing is it's not, you can't just say to someone, particularly when they're debilitated, oh, stop worrying about it. It's a very unhelpful thing. If you've ever had someone say, you just stress less, just don't worry about it. It's an awful thing to hear. So it's not that. And that's what the clickbait headlines will be too when they hear that someone like me says, don't worry about it. The clickbait is psychologists say, don't worry about sleep. But it's not the thing is, not getting worried about it is because that's what it is. People are either worried about not getting adequate sleep, that perpetuates it, or there's this hyper focus, the preoccupation on sleep, and that's the problem. So it's not that. Sort of what we do then is actually make sure that they get introduced to highly effective, well-researched strategies, and we'll get into that, and that's cognitive behavioural therapy for insomnia, CBTI, and people will know that they can have what it helps to them to do is get them out of bed stressing about sleep. They still might be stressing about sleep, but we do that outside of the bed, and they have a strong relationship with the bed is where you sleep, and you sleep nowhere but the bed, and you do nothing but sleep in bed, or intimacy is the other exception. But it's actually having this really strong, and from that success, it might only be a few hours. You might get 4 or 5 hours or less, 3 or 4, and they're confident that success will beget more confidence and skills, and that's how the cycle is sort of busted open. But it takes months. People have built this up over sometimes many years, if not decades, and then the busting of the downward cycle takes many weeks, if not many months, with good constructed evidence-based cognitive behavioural therapy for insomnia, with either online, digital, or with an in-person if you can get it. But that's another issue, but the access is really problematic.
So that really, really strong behavioural association between the bed and sleep, and even if you need to, as Norman said up front, restricting your time in bed, so you're kind of increasing the amount of time you're sleeping when you are in bed. Two really hallmark strategies of CBTI.
Absolutely.
Moira, probably the most common question we got, we put a bit of a call out to questions before the webinar, was I wake up at 3 a.m. and no matter what I do, I can't get back to sleep. What's your advice for people in that situation?
Yeah, and there's two really significant parts to that question. One is I want to re-emphasize that waking up is normal. We all wake all the time, all throughout the night. We have these sleep cycles that go up and down, light and deep sleep. And so we wake all the time. I would wake probably 3 times every hour sometimes, but I'm not maybe aware of it. So that's part of it. And the other part is knowing that it was 3 a.m. indicates to me that they've had some kind of time check. They've looked at some kind of clock or device. So the answer, I get this all the time. It's probably it's interesting. It's the question that came up the most in this forum, because it's a thing I get asked the most. So what happens is normalizing it, trying not to worry about being awake. Don't even open your eyes if you can in the first instance. Try not to have any devices that have time at your fingertips while you're in bed. And then the rule of thumb again is like, if you just go back to sleep if you can, roll over. Sometimes even someone like me, who we know, screens are bad, etc. I might just have a little. If it's straight away, I don't get up. But if I've been awake for what feels like more than 20 or 30 minutes, because I don't have a clock, I'm not watching the time, I would get out and, especially if I'm frustrated, go and sit somewhere else, wait to get sleepy and tired, come back into bed. So it's very difficult to do. These are very simple strategies. The thing about CBTI strategies, they're very, very simple, but they're not easy. They're not easy for people to do, particularly when they're already debilitated. They've got comorbid, other things going on with their health and mental health. So that's sort of it's a kind of, that's as succinct as I should be for now, because we can talk about it further. But there's sort of the nutshell of what it means to wake up at 3 a.m.
Can I just add something very briefly to reinforce that waking up during the night is normal? When you've got a friend whose baby slept through, almost certainly their baby did not sleep through.
No.
Every baby wakes up many times during the night. The difference is how much they wake up and whether they start crying and so on. But waking up is entirely normal. So they're just lucky they got a baby that doesn't bother them and is probably just sitting looking at the ceiling and then going back to sleep. So that's a very important message to get through, is that waking up for all ages is normal.
Yeah, it's a fantastic point, Norman. Thank you for chiming in with that. And we're getting a lot of questions about sleeping medications. I might come back to you in a minute, Norman, about those, but I'll move to Karina now. Now, Karina is one of our Beyond Blue speakers. Now, Karina, thank you so much for being part of this conversation to share about your experience. Are you happy to talk us through kind of the role that sleep has played in your mental health over time?
Yeah, absolutely. And I think it might be helpful to let people know kind of how I started experiencing sleep problems and what they looked like, so that people get a sense of that. So I think I first started experiencing sleep problems with my first child, and it wasn't the typical kind of sleep deprivation that you might have from having a baby. I did have that, obviously. But the early stages of my son's life were marked by depression on my end. I didn't take to being a mom very well. It was a really difficult time for me. I didn't really connect and bond with my baby like many other people do. So not only was I sleep deprived, but I also had that depression that was happening in me. And so in the early stages of his life, I didn't want to get out of bed. I struggled to get out of bed because I just wanted to stay in bed and sleep. I didn't want to face the days, so there was a bit of what was happening with my sleep. And then even when my son's sleep patterns started to be more regulated as he grew, I still wanted to sleep. I wasn't engaged. I was feeling flat, all of those things. And in some ways, sleep was an escape. And I did use it as a bit of an escape. When he slept, I tried to go to sleep rather than be engaged in my own life, because I just wanted to hide, from the world. When my son was about 7 months old, my husband, who was in the Australian Defence Force at the time in special operations, my husband was deployed to Afghanistan. So I was, that's the period in which anxiety was born for me. So at that time that my husband was deployed to Afghanistan, a number of his colleagues had already been killed in action before he went over there. So there was the worry about the dangers that he faced and whether or not he'd come home. I did not have a support network at that time. So my family was all in the United States, where I'm from. My husband's family was all in Western Australia, where he was from. So I didn't have a network. So my brain was kind of that beast in my life, in a sense, that was telling me all these things. I'd gone back to work part-time because I wanted to try to have connection and in a sense, reclaim those bits of myself that I lost. But, I was really struggling. And so with anxiety came a whole range of other issues in my life. I was angry all the time. I was fidgety all the time. And I had physical things as well. We talk about the connection between your physical health, your mental health, and sleep. I had random nosebleeds. I would get heart palpitations, chest pains. I got this strange kind of cough catch that would last for weeks and weeks that I couldn't quite explain. And this incessant kind of irrational worrying, especially when I laid down at night to go to sleep, when life kind of quieted down and I could lay down, that irrational, incessant kind of catastrophizing worrying that happens when you have anxiety. And it got to a point where it escalated, and I became convinced that I was going to die. I was going to either have a heart attack in my sleep, or I was going to die from some strange respiratory condition because I couldn't figure out this cough. The doctors couldn't figure out the cough. And I became convinced I was going to die. And so I didn't like being a parent. I didn't like my situation at that point, but I didn't want to die. So I found myself trying to avoid sleep. I didn't want to sleep because I was afraid I would die. And so I tried to do things that, avoided that. So I stayed up late. I filled the void by working. I would work at night because I thought that would, help also counter this sense of I'm not good enough, that thing that your brain tells you when you have your anxiety. So I wasn't good enough at work. I wasn't a good enough parent. I wasn't a good enough wife. So I filled those voids of not wanting to go to sleep by trying to work. So obviously my brain kind of never really turned off, in a sense, and it became really, really difficult. So I had kind of this journey of too much sleep, probably in the early days, or really craving sleep to avoid things, to then not being able to sleep and fighting sleep because of all the things my brain was telling me was going to happen to me if I did. And then trying to also figure out how to manage my son's sleep, virtually as a single mom, in a sense, with this little boy, trying to figure out how to get him to sleep. It's a really kind of debilitating kind of period of time when you have all of that going on. And then, trying to show up to work the next day, trying to show up and be, productive, or be a good role model, or be anything that was sort of productive in life after trying to avoid sleep for hours on end. Yeah.
Mm. I think there's a lot in what you've just said, Karina, that would resonate really strongly with people, like the expectations versus reality of new parenthood, what you're going on, like just the fear with your husband's situation. There's a lot you were dealing with at the same time. What were some of the ways that you helped turn the corner on that? How did you get through that?
Well, the first thing I did is, I had to get help. I realized I needed help. Unfortunately for me, I didn't get help until after my husband came back. So my husband was overseas for probably 7, almost 8 months. So I'd gone through that period of time of being really anxious for that whole time. And I just kept telling myself, oh, it'll be better when he comes back. It'll be better when he comes back. And it wasn't better when he came back, because there was a whole new set of challenges to deal with, of a son that doesn't remember his dad, a dad who thinks he's coming in from a very black and white life and death situation to a household that's totally different than what he dealt with, and a wife whose brain's not really quite working very well at the moment, so it was a lot of challenges. So I actually didn't get help until my son was about 15 months old. So I went, nearly a year and a half before I got help. Went to a counselor, and so obviously started working through all of the issues of anxiety and everything with that, even after my husband came back, because, found it wasn't really only that he'd gone to Afghanistan. There were other issues I had to unpack. And then my counselor really helped me a lot with the sleep aspects of trying to accept that you've got a really shitty situation right now. I'm sorry for swearing. But you've got a pretty awful situation. Let's just accept that, not try to should it away. It should be this, it should be that. It isn't. So let's just accept that. And he did help me with a lot of sleep, because it was the worry that I carried around. So one of the things he had me do was get a bowl or a jar or something, and I ended up getting like a big beer mug. And he said, have a sticky note and a piece of, sticky notes and a pen next to your bed. When you can't get to sleep, or if you wake up sleeping and you've got all those thoughts in your head, just write them down and put them in the jar. Write them down and put them in the jar, and say, I'll deal with that tomorrow. I'll deal with that tomorrow. And that was just a way of acknowledging it, but pushing it over here. I wasn't trying to make it go away. I wasn't trying to solve it that night. But I was going to say, okay, I'm acknowledging this. This is in my head, but I'm just going to park it. I'm just going to put it here. And it sort of helped take the weight of worry, that you would have. It kind of took that weight away. So that was one thing. And then we talked a lot about just, sleep strategies of getting a regular pattern. For somebody who is avoiding sleep, that regular pattern, going to bed and waking up roughly the same time every day. Again, don't have a television in my room. My room is a very inviting place, and when we go to sleep at night, it's sleep. There's no television, there's no fun things, there's no phones, that we scroll through or anything before bed. I do have a phone next to me because it's my alarm clock and because I've got family overseas. If anything happens, I want them to be able to reach me, but it's got a cover. My notifications are on silent, from 10 p.m. to 7 a.m. There's no notifications. I think the other thing, and it goes back to maybe something that Norman first brought up about how much sleep you need. I started to understand what I needed, okay, for sleep. What made me feel good in the morning and made me feel rested. So I started to get in tune with that, and I honor what I need. So if I need to go to bed sooner than my husband because he wants to stay up watching some, movie or whatever, I'll say, I'm sorry, I'm going to bed. And I don't feel bad about it anymore. Okay. I used to feel bad about it and say, oh, I should stay up and, hang out. But I think you have to understand yourself, know what you need, and honor what you need. So when I need 8 hours of sleep or 8.5 hours of sleep, if that's my sweet spot, that's what I need. I don't apologize for it anymore, for going to bed on time. You've got to honor what you need and without apology, and make sure that you're doing that. That's part of how I stay well, is getting that kind of sleep.
Yeah, fantastic. Thank you so much for sharing that, Karina. I think that point around, for you to stay well, you really need to prioritize your sleep, and
Absolutely.
your behavior needs to follow that, I think, is a really great point. And the interesting thing about when your mind is racing at night, and your mind is really reluctant to give up a worry. It doesn't want to give it up. So that idea of, I'm going to write it down to show my mind that I'm hearing you, it's important. I'm not going to try and push it away because it'll come back twice as strong, but I'll get to it tomorrow. We'll deal with it then. And allocating some time the next day to go through those worries and problem solve them. I thought that was a really lovely kind of realistic strategy as well.
Can I ask, Karina, did you ever actually open the jar and look through the problems, or they were just there?
Well, we did. Actually, my counselor asked me to bring them in, and he said, wow, that's a really heavy glass. You've got a really heavy glass. We've got a lot of stuff to go through. But yes, we did. We would go through them and say, okay, these are the things. What are the patterns that we're seeing? And we started chipping away at those things that were creating the worry, because putting them aside was just the first step. Then you had to actually deal with them.
And can I just add a little tiny thing there to the such great strategies that you got a great counselor or psychologist, whoever you saw, and I would add to make sure, if possible, to do that outside of the bed. Because just before you get into bed, sitting out in the lounge room doing your sort of your worry diary or your notepad then. But I suppose in the middle of the night, of course, as you say, we're just trying to have that strengthened relationship that you don't do much at all once you're in bed, and get out and do your activities, come back when you're sleepy. You have that strengthened, classical.
One of the other things that I found, and it goes to both when you're falling asleep, but also if you wake, and your head starts spinning through all those things, one of the best ways to counter the negativity, to counter the negative stuff, is to amplify the positive, right? So another thing that I do if I'm lying in bed, rather than let my head go through all these things at work or this or that or the other, I actually try to think of something really positive, and it's not real, but it helps me. So I sit there and think, okay, if I win $10 million in the lottery tomorrow, what am I going to do with it? Who do I give it to? What charities? And I literally kind of go through a list in my head of, all right, how much is mom and dad going to get? And what about my sister? And what about my brother? And then this, and it's just
that would keep me up, Karina. I would get to sleep.
No, but for some reason, it's almost a bit like it's that methodical list. I'll just kind of go through, but it doesn't come with a worry. It comes with joy.
Yes.
So it replaces the negativity, and it replaces that with the positivity, but that rote nature of going through the list of things. Which charities would I, and don't worry, Beyond Blue, you'll be well looked after if I ever win $10 million. but what are the, what would I do with it? And it's more of a calming, positive thing that helps me let go of the negative stuff, and then I can fall asleep.
So I'd be interested in Maura's view on this. When I was researching this book and my previous one, I came across a repeated message in the scientific literature that relaxation exercises can make things worse. Because they can, first of all, you spend time on them, but they're not necessarily getting to the root problem.
Yeah, I was going to say, it depends on what's the mission. Like sometimes people can address, they can say whatever type it is, mindfulness or a relaxation. And
I'm talking about the squeezing muscle thing and
progressive muscle, whatever it is. There's no one particular one that's better than anything other in terms of the research, but it's meant to. It depends on what you're trying to get out of it. Sometimes people are sort of doing that, like almost doing their relaxation in a too rigid way, and expecting that it's going to make them sleep, rather than just doing it as a general letting go of the day, come what may with sleep. I don't know if I'm going to sleep well tonight, whether I do the relaxation or not. So it's what we attach to it, the expectation, sort of the expectancy effect of what the relaxation is meant to do. So it can make it worse, absolutely. It can actually accidentally drive up the hyperarousal. That the person can just feel, oh gosh, I feel more stressed now because even after the relaxation exercise, I'm still not sleepy. So they're better off, sitting up, reading, going for a walk, even doing something rather than don't focus on trying to get to sleep.
That's really interesting work. So it's a little bit like sometimes the harder you try, you're like in a tug of war with sleep, and the harder you're trying to beat it, it's kind of having a counterproductive effect. Is that the sense?
I wish I had one of those Chinese finger traps. I used to have them sometimes for presentations. That the one I'm talking about, this little Chinese finger trap. You put your fingers in, and if you relax, the fingers can come out pretty easily. But once you really trying really hard, they get trapped. And it's a similar analogy with insomnia, that the harder we try and put what we call, in textbooks, we call it sleep effort, because there shouldn't be effort put into sleep necessarily. In general, the best sleepers in the world don't put a lot of effort in. They just sleep well. They look at you blankly when you ask, how do you sleep? They don't, but that they have good health, good routines and etc. So trying the sleep effort and trying too hard can be counterproductive. And even if you're doing evidence-based things, like things that you say, oh, I heard that was good. I heard that was good. So back to Norman's point, I think really early on around the individual differences and the nuance and Karina too, talking about, I had to know myself. So I think this is one of the tragic, it's a bit exact. It's a difficult thing. Someone who's been a clinician and thought, right, I'm going to step into the health promotion space. I want the general public to hear these things. It's really hard because you can't give, it's so general, it's not necessarily going to work for you. Even some of the things Karina spoke about that might not work for someone else. Right. And so it is hard. And so that's why it's good to overt that and for people to become a bit more high in their health literacy. Part of getting advice, getting evidence. Even the dementia stuff, Norman, I have to put a quote in or a plug in for good. There is really good quality sleep research in Australia. I think you said it's not done well. Some leading universities in Australia do very good sleep research. But I forgot what I was going to say there because I had the other. Back to you, Luke.
Yes, thank you, Maura. We are getting so many questions in the chat. We might really open up this panel conversation even further. As I mentioned before, Norman, a lot of questions about sleeping tablets and what role they should play in someone managing their sleeping problems, and are they safe to take over the long run? What are your thoughts on that?
I think the first step in, and Maura's the expert here, from my reading of the literature and studying the literature, the first step when you have insomnia is behavioral and psychological, and dealing with that. And no medication is going to solve that for you. And you stop the medication, you've got withdrawal effects, and you're back to where you started. So it's not never. Sometimes, and again, I'd really be interested to hear from Maura on this, sometimes a day or two, just very short period of medication can help you just get over the hump. But by and large, it's not a strategy that is going to solve your insomnia. It will create its own problems. Some of these sleep medications have unpleasant side effects, unpleasant behavioral side effects. They don't give you a natural night's sleep, even though the manufacturers say they do. So I just think the focus of this discussion is absolutely right. It's about you, your psychological world, your own mental state, what's going on in your world, and dealing with that. That's the fundamental issue, and your individual variation in terms of your sleep pattern. Trying to impose what you think is the perfect sleep pattern with a drug is just doesn't make sense.
Yeah, I agree, and I would add that it's sometimes there is a place that short term, or just occasional. Like sometimes people who have come off, they've done some good CBTI or other types of therapy, and they've become good sleepers again, or reasonable sleepers. But I would often say to them, maybe just keep a tiny little blister pack, like maybe 6 left or something, that you might have when you're traveling, or when you've got something you're really, really anxious about the next day, or intermittently. But they're not, the gold standard in the first line of treatment is always sort of cognitive behavioural strategies. And even say with children, I know a really great team of paediatricians that work at the Children's Hospital here in Melbourne that specialise in sleep. They, even with kids with pretty special needs, a range of different syndromes and ADHD and autism spectrum, they would give melatonin, for instance, but very, very rarely. And it's only after behavioural cognitive strategies haven't, a good dose of that hasn't worked well, or they need an adjunct treatment. So it's very much in nearly every case, the first choice is to not do medication.
Yeah. There's a real appetite. I'm seeing it in the chat as well as in the consultation we did before this webinar around, I guess that idea of how do we move, what's after sleep hygiene, what's after the behavioural strategies when I've tried these things and they haven't really made that much of a difference. Moira, is there anything around the corner in the research, like cutting edge interventions that people should know about?
No, I suppose the cutting edge with sleep stuff is the old-fashioned things, like the innovation. Sort of going back to basics is the innovation, ironically, like sort of trying to cut back. But I would say in the pipelines for sleep and the sleep world and the circadian world is much more emphasis on light. Like people, really understanding, particularly with mental health, the role that light plays with depression, and the risks that people who are having a lot of light at night and not enough during the day, not only does it affect their sleep, but it affects their risk of mental health conditions. So that's a big innovative, watch this space for that. That will probably have innovation around knowing how much light exposure we're getting, probably more helpful than how much sleep quality duration we're getting and all that sort of stuff. Like the trackers they're great. They've got their place, but they can cause sleep anxiety in some people. And also it's just the monitoring. It's just like a sleep diary. In the old days, it used to be a bit of paper and a pen writing down what you sleep. They're not an intervention per se, but the interventions will be perhaps with altering your light and dark will be that's where the really good stuff will come. I think we're getting a better understanding of that will help a lot with sleep and help a lot with mental health conditions for sure.
And so that is the light goggles or the light boxes. Is that what that intervention looks like?
Maybe, but no, sometimes more just as basic as turning off your overhead lights at night.
Yeah.
There's a lot of talk around the devices, but people haven't got the message yet to put yourself in dim light conditions in your own homes and get out in the natural light as much as you can, or be in the window in your office if you can, go out for walks. Just as basic as that. And then sometimes it would be some kind of device might be needed to be bought. But mostly it will be free stuff that's just us upping and downing our light. But perhaps there'll be light exposures. I think I've seen little pins and things that people, a new thing that might be able to do that. People knowing how much light they're in, because we don't really know. It's a bit of guesswork how much intensity we're in. So I think that's probably the one of the most innovative things in sleep at the moment.
Yeah,
and it's those light transitions.
Yeah.
It's coming into land. It's waking up.
Yes.
And that's where the dim light comes in at home. You don't just go from, Studio 10 lights to nothing, and those transitions. And the other thing I would say, again, not being, an active clinician, but reading the literature, is you may think that you're doing everything right, but it's still worth seeing a professional, a health professional who's an expert in this area, who can strip it all back and say, okay, what are you doing? And it may well be that you're doing everything perfectly, but it may well be that underlying a lot of this is an untreated anxiety disorder or untreated depression, even at a fairly mild level, which could be having an impact. Or you started to drink a little bit more early evening and you think it's going to be okay for sleep. There's just stuff that you can strip back. It's very hard to strip it back for yourself, back to basics, and then rebuild. And sometimes, I mean, Maura's got the clinical experience, then it starts to work because you've gone back to basics. Maura, do you think?
Absolutely, I think so. I think it's really important, Norman, your points around being able to have someone else impartial perhaps involved in being able to make you a bit more accountable to, and actually doing that assessment of what do you think the factors are, and more so even like the why, like stripping back the why behind our behaviours. I think, Karina, that was so important for you you sort of knew why, I think, but it was hard to get the how and the when, how to get out of it. It took a long time to get to the right help. And I think that most of the stuff with sleep, I would, in terms of a sort of a stepped care approach, like a sort of a pyramid, most people at the top will be seeing a health professional, a specific sleep person, for instance. The vast majority down the bottom of the pyramid will be able to self-help and self-regulate, because we'll have to have it in that way, because, you know, digital access, etc., or people being able to self-help will be the way. Because if we think half of Australians don't sleep well on any given night, and maybe 20% or 15% have chronic insomnia, many millions of people per year probably seeking help. And, you know, maybe, I know there's 30,000 psychologists, for instance. I'm not sure how many medical practitioners there are in Australia, but we're never going to be able to counterfeit the problem. But the resource, the demands will always outweigh the available clinical resources. And I think that's why, I suppose, Beyond Blue and Sleep Health Foundation or other and the like can help with the prevention, and also with showing people the right doors, like getting, you know, don't waste too much time trying to get quicker access and better sort of triaging of getting to where you need to get to.
Yeah, thank you, Maura. Karina, a few questions about just, you know, when you've had a few nights of bad sleep or a few weeks of bad sleep, and you're in that daytime mode where it's hard to concentrate, it's hard to make decisions, you can be more emotionally reactive than usual.
Yeah.
If you can think back to, you know, those days for yourself, and how did you manage on those days? What were some of your coping strategies?
Yes, those were difficult days. You know, days of going into the office, you know, while my husband was away and dealing with, you know, little boy on my own kind of thing, they were hard days to show up, you know, and to be present. And there were times, obviously, that, as I mentioned, I think some of the physical manifestations of anxiety, because it's not all just in our head, right? It affects, you know, the whole body in a sense. So I would be getting those heart palpitations and things, and the anger. I found I would just be so angry so quickly and kind of strike out and not very patient and stuff. And so I could feel those things coming, whether it was the heart palpitations or that fidgety kind of thing or the breathing. I could feel it intensify. And so when those things started to happen, the best thing I could do, whether I was in a meeting or on my own or whatever, I might have just said, can you just excuse me for a couple of minutes? And I would literally kind of have to walk away, go find a place. Ideally, if I could look outside and see trees or the ocean or something, I would need to look outside if I couldn't be outside, you know, if I was in an office, but to look outside and just deep breaths, you know, look out at what was happening in nature and just hold on to something, you know, put my hands on something and almost in a physical way to ground myself, to say, it's okay, you're okay, you know, it's fine. And just breathe and breathe and breathe and just look at the trees or at the beaches and just kind of do that calm breathing. And then I could go back, you know, and I could re-engage in whatever that conversation was. But for me, it was, if, you know, seeing nature or being in nature, it's just this calming effect. So if you can go for a walk, even if it's just, you know, around a courtyard, if you can do that, and if you can just sit and be with yourself and touch something, hold something, you're grounded, you're okay, it's okay.
Yeah, it sounds like those little moments of pause were
Yeah,
very helpful. Just kind
it's
of
like
ground you.
taking, it's the adult version of time out. You just got to take the time out and just have that breathing and concentrate like you're all right, you're healthy, you're here, you're okay, it'll be fine,
Yeah.
and then you can kind of go back to it.
And I think this comes to the individualization of response. I really am not a great sleeper. And, and sometimes I make the mistake. I mean, Maura alluded to it, that you inevitably, don't do the right thing and you regret it. But I'm a napper.
Yeah.
So
I've heard that. I heard you on another podcast, Lisa Leong, I think.
Yeah,
you like to take naps in the middle of ABC.
I'd win the Olympic gold for napping.
You can nap sitting upright, can't you, Norman? Is that true?
Yeah, no. It's quite disconcerting for my colleagues at work. So I'm lucky I'm in that situation. But I do it through mindfulness, a version of mindfulness, which is that psychologists talk a lot amongst themselves about something called attention bias, where you're devoting your attention to, and this would be how you approach, say, cognitive behavioral therapy for insomnia might be. You're focusing too much on the insomnia. Let's move your focus somewhere else. I mean, I'm oversimplifying what's a very complicated thing. But people who are trying to get off to sleep try to focus on silence when it might be quite noisy outside the door. And my technique is I focus on the noise. So I really, I spend all my attention on the noise. And it's so boring that you fall asleep. And so when I get on a plane, I focus on the safety announcement, and I don't think I've heard a safety announcement for years because I'm asleep by the end of it. And it's a mindfulness technique. Now that suits me. It won't suit other people. And some people might nap too much during the day and it affects their evening sleeping. So you've got to get that balance right. So I'll only nap for 10 minutes. I won't nap for half an hour or an hour.
Can I actually ask a question?
Yeah, go for it. Yeah.
Of Maura and Norman. I love a good nap as well, but my family says that when I go for a nap, it's not a nap, it's a second sleep. Because
like it's out.
There are times where I could go off and, just be bluntly honest, I can go and sleep on a Saturday afternoon for 3 or 3.5 hours. And part of it, might be, and my counselor has said to me, honey, you've been fighting your own brain for a really long time. It's okay to be tired, but is there such a thing as like too long of a nap? Now I am conscious that I can't do that late in the day because then it affects how like my regular timing of going to bed at night. But there are days where it's just like, I just need a nap and I'll be gone for 3 hours.
Yeah, I think that's the bottom line, Karina, is that the reason for the nap, like how sleep deprived you are, and whether it affects your nighttime sleep that night. That's the main thing. And the other caveat is waking up out of deep sleep. Sometimes you can have this sleep inertia where you just feel really groggy and disorientated. You can't get going. So they're the main things. But napping is a really important tool for a lot of people, particularly shift workers and people who, I mean, generally speaking, people with insomnia aren't encouraged to have big, long naps like that. Yeah. But it's life, Karina, isn't it? And I think depending on what you need, and you just have had a bad week and not feeling very well, depends. I mean, generally keep your naps short and sharp so you can actually get some reset and increase alertness. But sometimes maybe, Karina, it's just that hiding away as well. Sometimes it's just your brain needs to just let go and perhaps have a rest from everyone else. It's sort of that. But yeah, in terms of sleep, the advice is generally to keep them to less than 20 minutes or so.
Okay.
And you feel more alert. Under 20 minutes, you feel more alert when you wake up. More than 20 or 30 minutes, you feel quite groggy for a while, but your alertness lasts longer, which could then affect your evening sleep. So there is a bit of science around napping.
Exactly. It's really good evidence of, around sleep pressure. There's these two main things, our circadian system and this thing called sleep pressure that regulate our sleep, as well as all these other biopsychosocial things. But, it's important to make sure that your sleep pressure is as high as possible. That's our aim, is to have, it's like the highest possible peak for your toboggan. You can get a really good run if you're really, really extra sleepy and extra, as sleepy as possible. The high sleep pressure will help. And that means that regularity, that's why we talk about regular sleep, to try and getting up at the same time every day can help build that sleep pressure. So the 8-hour or the 6-hour sleeper needs 18 hours of wakefulness in a way to get the 6 hours, and you need to be consistent about that, which is tricky in complex lives to be consistent.
And you've got to recognize that sleep pressure. It's a bit like surfing. It hits you, and when it hits you, if you're reading a book or something like that, you've got to close the book, turn off the light, and put your head down because you're catching the wave.
Yeah, catching those tiredness cues is such a great point, Norman. It's really important. We are. I reckon I might be able to squeeze in 2 very more quick questions. Norman, I'll come to you for this one. You touched on this at the beginning around teenage sleep and that phase delay that happens where teenagers kind of naturally go to bed kind of a lot later than they did as kids. So in terms of your book themes, what do parents need to know about teenage sleep and how to manage that?
Well, luckily my book stops at 10, deliberately so. But that's what I'll say is that those ages, those ages 5 to 10 are under-researched. Parents are told these are the salad years, nothing much happens, and a lot happens. And hormonally, adolescence probably starts at 8 or 9 in many kids, even though you don't see it in their physical attributes. So there's things going on then that you can start to detect. And it's also the tail end of where you have your maximum influence on your children. There's two times of plasticity. There's the first couple of years of life, and then there's another time of plasticity towards 10, 11, 12, 13, when the brain's being pruned. And you have an influence on that, but also the external environment. So all you can do is work with the child on darkness, no screens. You'll lose as many battles as you win, but what you've got to achieve. And then you've just got this biological thing that teenagers do time shift their sleep. It goes back again, and the school system doesn't actually fit with that terribly well, and you've got to struggle with that as a parent.
Yeah, I'll say, Luke, I've got my son now is 15, my daughter's 13. We've got rules. There are no computers in the room. So if they've got to do their homework and stuff, they do it out in the common area. There's no computers. There's no phones in their room. Their room is tidy. I mean, the other thing too, we talk about a dark area. Their room is tight. It needs to be tidy when they go in, and I guess we do it as parents ourselves. We want that room to be an inviting, relaxing place. So mess everywhere and clutter everywhere doesn't help them. We think so. We try to, no computers, no phones, low light, and like a low light next to their bed, not the overhead lights, and their room is tidy. And it just kind of helps transition them into a relaxed atmosphere.
It's so interesting you say that, Karina, because in researching this current book, is that particularly if you find parenting rather chaotic, you'll often find the house is chaotic. And without doing anything in terms of parent training, if you simply tidy the house, a lot of things get better. So and there's a lot of evidence for that. So it's really interesting you say that.
Moira, I'll give the very final question to you. We've had a lot of questions about ADHD and sleep and how sleeping patterns play out. What are kind of your observations and any management advice?
Yeah, it's really important. I think sleep is harder in people with ADHD, and there's a number of reasons around perhaps racing mind and being a bit more, high energy, etc., especially around nighttime. But there's an increased risk of sleep disorders too, especially that the delayed sleep phase that's quite common in teens. It's very, very common. I think a lot of people with ADHD have that delayed circadian system well into the adult years as well. And sleep disorder breathing. I think sort of about 40% of people with ADHD have a risk of sleep apnea and restless legs. And even I was sort of reading earlier in preparation that I didn't even know this, that half of people with adults with narcolepsy, twice as likely to have had ADHD symptoms, or whether a diagnosis or not. So the main thing is management is perhaps as calm as possible environment, all the things we've already talked about, but perhaps going even a little bit more effort into that, like to calm down. Like if we talk about unwinding for an hour before bed, maybe it's an hour and a half, etc. Making sure that that light and dark is really adhered to, and just understanding that getting some professional help. But as I said, the paediatricians still want the behavioural stuff first before going on to even things like melatonin. Melatonin is not as innocuous as people think. People think it's just like popping a vitamin, but it has to be something that's done in, under conjunction with a professional person that knows what they're talking about, and reviewed regularly as well. It shouldn't be that child's on it for their life. It's not necessary.
Yeah,
absolutely.
Exactly right. I really appreciate that, Moira, and I'm completely on me, absolutely terrible at keeping time. I've got about 1 minute to wrap this up. So I just really want to very abruptly thank the panel for all of your expertise and sharing your experiences today. I've really enjoyed this conversation. And obviously, thank you to the massive audience that have joined us as well. We've really been blown away with how many people have registered and been interested in this conversation. I've popped on the slide deck here a range of sleep resources and supports. You can follow the QR code, which will take you to a web page where they're all listed, so you don't need to write them down. They'll be there. You'll get an email after this webinar with all of these resources as well. Please remember, if you do need some extra support today, the Beyond Blue support service is available on 1300 22 46 36. But a shout out for Norman's new book. If you registered for this webinar, you'll go into a draw to win a copy. We'll let you know over email. The Sleep Health Foundation has some incredible fact sheets about everything sleep related you'd ever want to know. So please jump on the Sleep Health Foundation website. We will send you a feedback survey to let us know what you thought about this webinar. I'm really happy to take your feedback to inform how we handle these next time. And I guess really the takeout for today to me seems to be, sleep is a little bit like, grabbing a bar of soap in the shower. Sometimes the harder we try to grab it, the more elusive it is. So it's really about, small changes. They will add up over time. There's no kind of miracle overnight cures, but there is hope that some of these small changes can add up to really gradually improve your sleep over time. So thank you so much again for the panel and for listening, and we'll catch you next time.
Thanks very much.